A rash is a change in the color or texture of your skin. It can be itchy, bumpy, scaly, or just plain uncomfortable. Rashes can appear anywhere on the body, from the top of your head to the soles of your feet. Sometimes they cover a large area of your body. This is called a generalized rash. Other times they're limited to a specific spot. We call this a localized rash. Think of it like spilled milk. If you spill a little milk, you just need to clean up a small area. That's a localized rash. But if you knock over the whole gallon, you've got a much bigger mess to deal with. That's like a generalized rash. No matter the size, rashes can be frustrating. But don't worry, we're going to break it all down for you. Rashes have many culprits. Sometimes it's something that directly irritates your skin, like a harsh soap or poison ivy. Other times it's an allergic reaction, perhaps to a new laundry detergent or a certain food. Infections are another common cause of rashes. These can be bacterial, like with impetigo, or viral, like with chickenpox or measles. Even our own immune system can sometimes go a little haywire, leading to rashes like eczema or psoriasis. It's like your skin is sending you a message saying, hey, something isn't right here. Figuring out what triggered that message is the first step to finding relief. Rashes come in all shapes and sizes, which can make them tricky to identify. Sometimes they're flat and red, other times they're raised and bumpy. They can be dry and scaly or weepy and oozing. Doctors have special terms for describing how a rash looks. We look at its distribution, where it is on the body. Is it all over or just in one spot? We also look at its configuration, what shape it takes. Is it round, linear, or does it have a target-like appearance? Finally, we examine its morphology, what the individual bumps or spots look like. Are they flat, raised, fluid-filled, or pus-filled? By carefully describing a rash, we can narrow down the possible causes and get you on the right track for treatment. When you see your doctor about a rash, be prepared to answer some questions. We'll want to know when the rash started, how it has changed over time, and if you've used any new products or medications. We'll also ask about any other symptoms you might have, like fever, itching, or pain. Next comes the physical exam. We'll carefully examine your rash, noting its location, size, shape, color, and texture. We might even use a special magnifying glass called a dermatoscope to get a closer look. In some cases, we may need to take a small sample of the rash, called a biopsy, to examine under a microscope. This helps us determine the exact cause of the rash. Remember, the more information you can give your doctor, the better equipped we are to help you. Section 5. How to treat a rash. Treating a rash depends on what's causing it. For rashes caused by irritants, the first step is to avoid the offending substance. If an allergy is to blame, antihistamines can help reduce itching and swelling. For bacterial infections, antibiotics are often needed, while viral infections often clear up on their own with time and supportive care. In cases of eczema or psoriasis, we may prescribe topical creams or ointments to reduce inflammation and itching. Sometimes simple home remedies can also provide relief. Cool compresses can soothe itchy skin, and oatmeal baths can be very calming. Just be sure to avoid scratching, as this can irritate the skin further and increase the risk of infection. Section 6. Generalized versus localized rashes. What's the difference? Remember our milk analogy? A generalized rash is like spilling the whole gallon. It covers a large area, often affecting multiple body parts. These rashes can be caused by systemic issues, meaning they affect the whole body, such as an allergic reaction, viral infection, or certain medications. A localized rash is more like a small spill affecting a limited area. These are often triggered by something that has come into direct contact with the skin, like an insect bite, poison ivy, or a skin infection. Knowing the difference can give you clues about the possible cause of your rash and help guide your next steps. Section 7. Common rashes. A closer look. Let's take a look at some common rashes. Eczema, also known as atopic dermatitis, is an itchy red rash that often appears in the creases of elbows and knees. It's caused by an overreaction of the immune system and tends to flare up periodically. Psoriasis is a chronic condition that causes thick, scaly patches of skin. It's also caused by an overactive immune system, but unlike eczema, it's not typically itchy. Contact dermatitis is an itchy rash that develops when your skin comes into contact with an irritant, like poison ivy, nickel, or certain fragrances. Hives or urticaria are itchy raised welts that appear suddenly and can be triggered by allergies, stress, or even heat. And finally, ringworm, don't let the name fool you. This itchy circular rash is actually caused by a fungus, not a worm. Section 8. When to worry about a rash. Most rashes are harmless and clear up on their own or with simple treatments. However, there are times when you should seek immediate medical attention. If you experience a sudden onset of a rash that spreads rapidly, especially if accompanied by fever, difficulty breathing or swelling of the face, lips, or tongue, this could be a sign of a serious allergic reaction known as anaphylaxis. If a rash is accompanied by a high fever, headache, stiff neck, or confusion, these could be symptoms of meningitis, a serious infection of the brain and spinal cord. If the rash is painful, blisters easily, or oozes pus, this could indicate a severe skin infection requiring prompt medical care. And finally, if the rash doesn't improve or worsens despite home treatment, it's always best to err on the side of caution and get checked by a doctor if you're concerned. Section 9. Conclusion. Taking control of your skin health. Rashes are a common skin concern that can be caused by a variety of factors. Understanding the different types of rashes, their causes, and treatment options can help you take control of your skin health and seek appropriate medical care when needed. Remember, early diagnosis and treatment are key to managing rashes effectively and preventing complications. If you're ever in doubt, don't hesitate to reach out to your doctor or a board-certified dermatologist for guidance. Your skin will thank you for it.